This is Henry. Henry is our third child. He was not an easy pregnancy by far. I'd been going to high-risk doctors in Madison. Everything had been A-OK. Had a planned C-section in Madison on May the 20th and never made it that far. He ended up coming on May 5, 2025. That morning, I was like, I didn't sleep real well. Chalked it up to being 36 weeks pregnant, but felt really dizzy, kind of out of it. Not nauseous like I was going to be sick, but just dizzy. I was not able to stand. I was dizzy to the point where all it felt good to do was lay in bed. And I was like, something's not right. So I'd called into my primary OB and said, they're not feeling the greatest. And they're like, okay, let's get you in to see you, check you, see what's going on. Tried to do a couple things to feel better. Called my husband, said, we got to go to Madison. We're going to find out. And by the time he got home, I thought my water had broke. I've had 2 C-sections before. I'd never had my water break. Well, it wasn't my water breaking. I was actually bleeding. And when I called them to tell them that, they're like, your water's not supposed to look like that. I'm like, okay. They said, go to the closest place possible. And I said, the Columbus is the closest place possible.
The phone rang, it was St. Mary's. I'm like, well, that's kind of weird. They're like, oh, we have a patient stopping in by you. We think she's going to have a placental abruption. Told me she was 36 weeks. She was having a boy. And then they told me she had a really hard, rigid abdomen is what the patient was describing. And she had bright red bleeding. Said she'll be there in like 5 to 10 minutes because we were the closest hospital.
Things were coming hot and fast. We pulled in the parking lot in the emergency room at 10 o'clock. They brought me to this room and they started checking out to see what was going on with this guy.
It was obviously all hands on deck. We knew she was coming, so we were prepared and ready for her.
And she showed up and we checked her, but we noticed she was bleeding. She was kind of as pale as the sheet. Brianna was searching for baby. I got an IV in and then I was asking her questions and I got the vitals on her and Brianna was trying to find baby's heart rate.
And I remember looking at her, I can't find baby. So we tried to hurry. Luckily, doctor came in, found baby, but the heart rate was about 70, which baby should be about 110 to 160. So we called it right then and there and
said, we're going to have a C-section. You're going to have this baby right now.
Catherine had what's called a placenta abruption. So that's when the placenta tears away from the side of the uterus. And as you can imagine, that's how the baby is getting oxygen. So if you start pulling baby's source of oxygen away, then you have a very compromised baby on your hands. So we were anticipating resuscitation, so we were ready for that and had all the help we could ready.
When baby came out too, we had a great team of people because baby wasn't doing well when he came out. He wasn't breathing very well. His heart rate was low. So taking those initial steps too, like we got him back pretty fast. And then NICU came also very fast.
They got me fixed up with the C-section, but the doctor made the call to have him transported to Madison because of his loss of oxygen.
And I felt really bad because she couldn't go because she wasn't quite fully stable yet. So she ended up getting some blood.
Yeah, I had lost about half my blood volume. Between what I had lost when I was bleeding to what I lost in surgery. That's why they weren't able to discharge me to be near him, but I didn't get to hold him until he was born on Monday. Didn't get to hold him until Saturday.
It was just really rough seeing her separated. She took it so well.
That is so hard on parents and moms, especially to be here when their baby is in the NICU. A lot of times the dads will have to go back and forth. It stresses the whole family out.
The whole situation itself was pretty traumatic, but the staff made the most terrifying experience feel like it was all going to be okay.
Prairie Ridge Health has the most personalized care when it comes to labor and delivery. Different facilities, bigger facilities, they have 1 to 2 labor patients. They don't always get to prioritize like one patient and make them their like main set for the day. I really enjoy the fact that like it's a one-on-one thing for us.
I can't say enough about the care that the nurses provide to the patients. They are constantly getting kudos and accolades about everything that they do for their patients.
Honestly, I don't think you can ever prepare for heightened emotions like that. I remember after baby had left, coming out to the nurse's station and just kind of like crying.
A lot of things can lead to an emergency C-section. So if you do OB, you have to be ready for something like that. We train for everything: emergency C-section, shoulder dystocia, hemorrhage, preeclampsia, all of that stuff we train for. We don't always see that stuff on a daily basis, but we're ready.
Prairie Ridge Health has our business for life. We're thankful to everyone here and glad it's so close to home and we can get quality care close to home and not have to go to Madison or Appleton, things like that, because we would have not made it if we had to go further.
I'm thankful every day for that phone call from St. Mary's. It could have been a lot different outcome. That phone call probably saved both of their lives. I think about that a lot. I'm very thankful for that.
He would have not been here. So we're very thankful for the team here, and I'm glad we're here to tell our story and able to visit them and let them know how thankful we are for them.
When they do come back in and we get to see them, that's really cool aspect of working in labor and delivery.
You ship these babies off to the NICU and we don't really get to see or hear updates. So seeing that Henry is here, live, happy, smiling is a great, great feeling.
Isn't that awesome? I love that she came back and we got to see her baby and see the happy ending.
Those kind of days you just don't forget, but everything worked out perfectly. As a nurse, it makes me want to keep doing my job.